എന്തായാലും ഈ ഇന്നത്തെ ഫാക്കൽറ്റി നമ്മുടെ ഡോക്ടർമാർക്ക് വേണ്ടി ശാസ്ത്ര വിഷയങ്ങൾ പരിചയപ്പെടുത്താനായിട്ട് എത്തിയിരിക്കുകയാണ്. അദ്ദേഹത്തിൻ്റെ പ്രത്യേകിച്ച് ആശുപത്രിയുടെ പേരിലും AMAIയുടെ പേരിലും ഞാൻ സ്വാഗതം പറയുന്നു. ഇന്ന് ഇൻട്രൊഡക്ഷൻ ആരാണ് അശ്വതി? ഇന്ന് ഇൻട്രൊഡക്ഷൻ അപ്പോൾ ഡോക്ടർ രാഹുൽ നായരെ സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം നമ്മുടെ വെബിനാർ സീരീസിന്റെ പ്രത്യേകതയായിട്ടുള്ള പ്രായോഗികതയിൽ ഊന്നിയ ശാസ്ത്ര പരിചയവും അതിൻ്റെ വിജ്ഞാന സംക്രമണവും എന്നുള്ളതാണ്. അത് എല്ലാ അർത്ഥത്തിലും അത് പങ്കെടുക്കുന്നവരിലേക്ക് പരിണമിക്കുന്നുള്ളത് കൊണ്ടാണ് ഇതിൻ്റെ ഒരു ജനപ്രീതി. യൂട്യൂബിലായിരുന്നാലും സൂമിലായിരുന്നാലും വ്യൂവേഴ്സ് നമുക്ക് അത്രത്തോളം ഉണ്ട് എന്നുള്ളതാണ്. എന്തായാലും എല്ലാവരെയും നമ്മുടെ സെമിനാറിൻ്റെ സമാപന വാരത്തെ വിലയേറിയ പ്രോഗ്രാമിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. അതോടൊപ്പം ഇന്നത്തെ ഇതിനെല്ലാം ആശംസയും അർപ്പിക്കുന്നു. ഡോക്ടർ ഭാഗ്യയെ ഫാക്കൽറ്റി ഇൻട്രൊഡ്യൂസ് ചെയ്യാൻ വേണ്ടി ക്ഷണിക്കുകയാണ്. ഓക്കെ, ഡോക്ടർ ഭാഗ്യ.
ഹലോ സർ.
പറഞ്ഞോളൂ.
Okay. A warm welcome to everyone. Thank you for joining today's webinar. Your active participation is important throughout the session. I am Bhagya, a representative from GDH VARKALA. Today we are presenting on the topic Understanding Irakkam by Dr. Rahul R. Nair. Before get started, I would like to say that if you have any questions or doubts during the presentation, kindly mention them in the Zoom chat box. After the presentation, we will discuss it together. And we are providing an e-certificate for the participant. The form for e-certificate will be provided. For applying e-certificate will be provided in the Zoom chat box. Participant ensure to fill the form for e-certificate. Without further ado, I would like to introduce our eminent chief guest, Dr. Rahul R. Nair, currently working as Associate Professor of Nidana Department of Ashtangam Ayurveda Chigilsalayam and Vidyapeedam. He completed his BAMS degree from VPSV Ayurveda College, Kottakkal, and his MD in Nidanam from Government Ayurveda College, Pariyaram, Kannur. Prior to the post-graduation, he worked as a demonstrator at Department of Kriya Shariram of Amrita School of Ayurveda and as a tutor at MVR Ayurveda Medical College, Parshinikadavar, Kannur. After post-graduation, he worked initially as a lecturer and thereafter assistant professor of Nidanam at MVR Ayurveda Medical College. During the period, he was instrumental in developing a cancer care clinic at the institution, and he leads the cancer care clinic at the same hospital. He is also serving as a senior visiting consultant at Sidaram Specialty Clinic at Kannur and Palakkad. He is interested to explore the personalized diagnostic and management approach of Ayurveda for recurrent era diseases and to synthesize highly effective solution by combining the best of technological advances and Ayurvedic wisdom. Sir, we are well privileged to have you in this webinar. And I invite Dr. Rahul R. Nair to this presentation, and I once again invite all the participants to this session. Thank you very much. Thank you, sir.
Okay. So, respected Dr. Baiju sir, respected doctors from different government Ayurveda dispensaries, respected clinicians who are attending this webinar throughout India, and also Dr. Bhagya, who has introduced me, and also to my very dear friend Dr. Ashwati, who has asked me, who has given me a command to come here and join this very active group to have a webinar. And she had given me freedom to choose any of the topic I want, and because I practice a bit in this area called Irakkam, I selected this topic. But while preparing the title, I was unaware that there were people attending from outside the Kerala also on this webinar. So I don't know actually what is the colloquial name of this Irakkam in Hindi. I don't know actually, but actually it can be translated to a clinical name called myofasciitis. I think many of the people are asking what is the actual title, but the disease will be there, but there will be some different names for this. So I am translating it as a clinical perspective on myofascial pain syndrome or myofasciitis. I put the title because I thought that there will be only Kerala people will be there inside. So shall I share my screen? Shall I share?
Yes, sir.
Yeah. Is it visible now? Yes, I think it is visible now.
Yes, sir. Visible on.
Yeah. And also, am I audible properly?
Yes, sir.
Okay. So, in place of Irakkam, those people from outside Kerala shall substitute accordingly or read as myofascial pain syndromes, exploring different perspectives. So here, my intention of doing this webinar, this is my institution, Ashtanga Ayurveda Vidyapitham. My humble welcome to all of you. And my intention is I'm speaking to a group of government medical officers who are practicing in the grassroots level, offering their support and seeing the patient population more than what I see in my OPD. I'm working in a self-financing institution, so, and a hospital, which is, I think, which will be accessed by people of some other category. But the great majority of people who come to the spectrum of ISM department, they will bring with a lot of presentations which are coming under the spectrum of Neer. And also I am addressing a gathering, an August gathering of clinicians, some clinicians who are spread throughout India also. So you are all seeing a large volume of cases, I suppose. And my entire presentation will be a gentle reminder of what you are all practicing today. And we are seeing a lot of cases coming with the musculoskeletal complaints. A lot of cases presenting with the different diffuse pain syndromes. See, you are getting a localized pain. That means, for example, knee joint pain. You are very happy. You are having a totality in diagnosis. You are confirmed in your diagnosis, so you can manage the patient well. But when the patient start to tell you a very varied type of presentations, likewise, I am having pain radiating from the neck, down my arm, down the shoulder, down through the thighs, up to my feet. The patient is telling so, we will be bewildered. Many a time, we will not be knowing how to prescribe an effective drug for this remedy. And the patient will be expecting some magic bullets, some sort of drugs which you take one single drug, then all the pain will disappear. The patients will be coming to us with the pain histories ranging for past, say, 10 to 15 years, but they want simple solutions. So if there is a diffuse pain, the pain which is spreading throughout the body with the bewildering presentations, it will be rather a traumatic experience, even for the experienced clinicians. Then what to say about the young doctors who are entering into clinical practice? And so I want to I want to convey you some essential points behind this syndrome, myofascial pain syndrome, which many a time bewilders us with its myriads of presentations. And I want to review the ground situation and put them all into perspective. That means I want to go through the different drugs and how those drugs are working in this myofascial pain syndromes. And actually, this myofascial pain syndrome is now an area of important concern. Why? Because we people, especially in Kerala, we have got a changing lifestyle habit. We have got a changed eating habit. We are getting changed pattern of climate. All those factors are creating increased stress in our body, creating different types of pain syndromes. And around the world, you can see that the climate is varying, the moisture content of air is increasing, the temperature is rising throughout the globe, and extremes of weather is happening many a time. That means if you have got snowfall, the snowfall is very heavy. You are having summer, the summer is very heavy. So your body is exposed to all those features, and that triggers doshic imbalances, and that triggers such type of system. So previously, when you go to the musculoskeletal treatment, you can see that one section of people will be specializing on knee, the other people on shoulder, the other people on spine. Now you are getting a syndrome which spreads through the entire joints, which spreads through the muscles, which spreads through the tendons, etc. So you cannot restrict it, and even it crosses the musculoskeletal system and it reaches the some other areas, and the patient will be telling you some symptoms which are to be addressed by an ENT person or ophthalmologist likewise. So in Western medicine parlance, this myofacial pain syndrome is a bewildering entity, but for us it is confined within, safely within our zones. That is what I have a message to convey you, because myofacial pain syndrome, even if you read the different types of presentation, even if the patient is coming to you with the different varieties of presentations, you can be assured that in Ayurveda, it can all be brought together into a platform. It can all to be brought together under the heading of one Samprapti. And that Samprapti can be addressed by using our very common drugs, and the patients are getting good remedy for that. So we should be confident in dealing with myofacial pain syndromes. Now you can see that throughout the globe, different Eastern medical traditions like Chinese medicine, acupuncture, etc., are coming up. Then chiropathy is coming up. All those sorts of medical systems are trying to address such diffuse pain syndromes which cannot be directly addressed by using simple painkillers or other remedies. So this is my intention of presentation, to highlight this disease syndrome and to tell you that this can be addressed safely by using our own medicines. And let me review this myriad presentations of Neer Irakkam. See, sometimes when a patient comes to your OPD and telling you that headache, and you start examining the patient, and then the patient tells that he is having heaviness of head also. He says he is having difficulty to open the eyes. There is heaviness of eyelids. And then you start writing a prescription. The patient says, please doctor, please stop. I am having burning sensation of scalp, eyes, earlobes, etc. Then you, okay, you told, yes, okay, I understand. Then you are planning for a medicine. And she is telling you that some fluid is moving in the scalp. So you become bewildered. What fluid is moving in the scalp? We know about a fluid which is situated internally, that is cerebrospinal fluid. Is there any connection between this type of presentation? She says, when you expose your hair, your scalp to sun, I feel some fluid is moving through my head. It is coming to my orbits, coming down. It is coming down the throat, etc. So you are hesitating to write a prescription. Then she says some pain is radiating from the neck, from the occipital area down to both arms. Heaviness of arms are there. Pain in the scapular region. Pain is passing not only to the neck, but down through the flanks. And you can see patients telling that when the pain starts through the flanks, she says after some 1 or 2 days, the pain will reach the thigh. It will pass through the anterior and posterior aspects of the thigh down. And when one morning, when you wake up, she says that I am having pain in the heel. See, the pain started from the neck, from the head. Now she says the pain is there in the heel when she wake up, and it improves by walking. And sometimes there are rolling up of calf muscles. And okay, all these pains you heard, you started framing a prescription. And then she says that when the pain is spreading, I am getting oily stools. So you're wondering, we will be wondering how she is saying like that. When the pain is spreading through the flanks into abdominal area, I'm getting oily stools. The patient is telling. Then she says, many a time I am having heartburn, sore belching, and I am having some sort of pervaginal white discharge, etc. So utter confusion resulted. Previously, when I am a graduate student, and when we were working with the Prakash Mangalasheri sir, I used to remember that when such type of presentations come, sir will do one technique. Sir will tell us that don't address the symptoms, try to address the Samprapti. If you start going to address the symptoms, you will be bewildered. If you write a prescription for one of the symptoms, all other symptoms will trouble you the next week. Instead, we need to educate the patient that I'm not going to treat your symptoms. Your pain will be there as such, but you will be improving. So such was a technique at that time sir was telling. And when we were studying for graduation, we were not at all bothering. But when we started sitting in the OPD, when I started to sit in the OPD and see such cases, I thought the advice is very relevant. If you go and chase the symptom, the rest of the symptoms will chase you. So this became a golden word in my memory. If you are going to chase a symptom in such particular situation, when the patient is presenting a lot of symptoms, if you go and chase one symptom, all other symptoms will chase you. So it's better not to operate on symptoms, but to understand in which samprapti, in which way this mechanism, this pain mechanism is operating upon. From where it starts, from where it ends, how it spreads, all these stories need to be learned. Then only you can address the symptoms. See, the problem is perceived many a times as diffuse, vague symptoms. Once one patient told me that very sad she was. She was telling that I went to a Western medicine consultant and presented all these things, and he immediately took a letter, written a reference for her, and asked her to meet this particular doctor. And she went to that particular doctor only to see that he is a psychiatrist. So many a time the patient is sent for psychiatric consultation thinking that she is telling something very much incongruent to the doctor. But the patient says, I am having all these presentations, but we cannot digest that. And trying for symptomatic improvement but fails. I told that. And medication advice alone will not help in this. You don't think that the medication will solve this issue. Never. Unless you solve the dietary problem, the problem will remain. Unless you solve the lifestyle issue, the problem will remain. Unless you solve the sleep issue, the problem will remain. Unless you solve the way you take the food, the style of food, the ingredients of food, your scalp bathing, that's also very important. If you wash your scalp in particular way, in particular time of the day, this will be aggravating. So the medication advice is not the alone help in this way, in this disease. You need to advise in a totality. You need to advise, you need to approach this disease from a very holistic platform. And when I tell this, in the earlier sphere of my clinical practice, in earlier days of my clinical practice, I also thought that this type of symptoms are very rare in society. But actually it is wrong. Our society, we are having a large section of people who is affected with myofacial pain syndromes or Neer Irakkam. The case numbers are surely going up year after year. I will tell you one good example why this is going up. I got a lot of patients who are complaining this myofacial pain syndrome immediately after the completion of winter. See, when the winter is getting completed in Kerala, the winter is not going to be extreme. But even after the completion of winter, when the summer is starting and when the summer is going to its peak, the patients are complaining a lot of problems. And when we inquire specifically where you stay, either they will be staying in the single-storied concrete house or they will be staying in the first floor of a double-storied concrete house. See, the concrete usually gets hot in the summer days, and the night it starts radiating its heat downwards. So when you start sleeping in a concrete roofed house in summer days, when that concrete is radiating the heat and the fan is pushing that heat onto your head, surely you will be, if you are a person with sensitivity, you will be having a chance of getting myofacial pain syndrome. This is my experience. So as the number of concrete houses are going up, this case will increase. Those persons with sensitivity will increase. Patients only tell, they will present only when these symptoms worsen. And the most important problem is that this condition of myofascial pain syndrome can superimpose on many other diseases. What do you mean by superimposing? You have got some other disease. You are having neck pain. This neck pain can come present along with the myofascial pain syndrome. So the presentation of neck pain will be projected. It will be projected to a great extent that you will be wondering how the neck pain is presenting like this. See, a lot of diseases, you can see a lot of diseases, coexisting diseases like allergic rhinitis, sinusitis. Patient is a diagnosed case of allergic rhinitis. Patient is a diagnosed case of sinusitis. He is a diagnosed case of asthma, but he is having myofascial syndrome. So you are treating myofascial syndrome in a patient of asthma. See, neck and low back related pathology is very important. When you operate on neck related pathology, if the patient is having myofascial pain syndromes, if you are not addressing it, the neck pain will be worsening. See, many patients with the GERD, they are having coexisting MFS, myofascial pain syndromes. So GERD will not be totally healed, totally cured unless you finish off the myofascial pain syndrome. Another important finding is pelvic inflammatory diseases, PID. Many women are complaining with pervaginal white discharge. So if you have pervaginal white discharge, and if you are having such myofascial pain syndrome coexisting with that, severe is the result. The patient will be complaining this problem. She is having other type of pains coming from myofascial pain syndromes. Bewildering will be the presentation. So when the patient is presenting to you along with a particular disease, along with myofascial pain syndrome, it is very difficult to extract something from the patient from which you can start. You will be confused. So this confusion I have experienced. That's why I am telling. And you can see that there are a big spectrum of very interesting observed Nidana in this patient, just like the one I have shared as the case of a concrete roof. See, one important finding is nude scalp bath. As medical officers, you all will be familiar with this issue. And this issue is particularly I am seeing in Muslim community. Why? Because many of the Muslim ladies are housewives, and they will complete all their work. They will send pre-COVID. They are having small kids, husband going to work. They will be doing all those household activities, sending the children to school, and then slowly doing all the work. And by 12:30, they are getting the time for bathing. And when they bath at that time, prior to their prayer, in the noon time, many people are having this complaint of myofasciitis. Another important finding is related to late night food. See, late night food is a very important concern. Many people, when you ask whether you eat early, they will tell, yes, I'm eating very early. At what time? Then that is your next question. The patient will be telling, I'm eating very early at 10 o'clock in the night. Very early at 10 o'clock. And then what time you will be sleeping? Yes, I will be sleeping very early, and that is by 10:30. So eating a full stomach meal. See, many a time in the morning time, there is a busy schedule of going to work. In the noon time, they will be in the working site or in the offices. And in the evening time, when the patient comes back to home, the patient is very well relaxed, and they will be taking a sumptuous meal in the night and taking that food, going to bed straight. That's a very important problem nowadays we are seeing. And I have met patients who are having a life. I have just previous 2 weeks back, I have met a young lady. She was only 23-year-old and just married for 6 months. And she has gone with her husband to Dubai. And they started a new life in Dubai. And you know, Dubai is famous for nightlife. And for the past 6 months, that young lady was thoroughly enjoying her life along with her husband in Dubai. But they will be uh, shopping till 2 o'clock, 3 o'clock in the night, then taking some food, then going to bed, then rising up by 8 o'clock, then rushing to the office, then coming back, going for again shopping. Likewise, their life was retuned. And the patient presented to me with severe low back pain, with severe pelvic inflammatory disease, and she is having severe allergic rhinitis. So all those things ushered up, they all came up because of her changed lifestyle pattern. So late night food is having a very great implication in the starting of this disease. Because when you eat late in the night and when you go to the bed full stomach, it is having an impact on your acne. That will create acne mandhyam, that will create amavastha. Then untimely food pattern, what to say about that? Nothing at all. All you know about that. Then there are people who are regular sleepers, more than 15 minutes, I have observed. You sleep lying down in the noon time more than 15 minutes, and some people will be sleeping for 2 hours in the noon after taking the lunch. So that is a big problem. And delayed morning wake up. See, in our science, it is told that Brahme Muhurte Uttishte. Even if you are not waking up Brahme Muhurtam, it is better to wake up by 6 o'clock. Some people with this myofacial pain syndromes, they will be telling, I will be waking up early. Their early time is 8, 8:30, etc. Now, when the COVID breakdown came up, I have observed many patients after this post-lockdown period, they will be coming us and telling that they used to wake up at 9:30 or 10 because they will be sitting in the TV watching Amazon Prime, etc. for late night and then sleeping. Another important problem that creates this type of pain syndromes. And then the patients will be generally having severe Kadu diet. They will be very fond of Kadu Ahara. They will be very fond of pickles. They will be fond of fried food items. Generally, the masala proportion in their food is very high. They are regular users of curd, oily substances, and pickles. See the combination. You are mixing Kadu, Ushna, etc. with the Snigdha, Sthira, Guna, Dadi. So Dadi is Snigdha and Sthira. Kadu is Ushna and Tikshna. And what happens when Ushna mixes with this Sthira Guna Dravya, it will be molten, or rather it will become a detrimental combination. So this regular use of curd along with the Kadu Ahara is very greatly seen. And nowadays there are tinned, caged milks. You are getting tinned milks, very thick in constituency. If you are using such a packeted milk, which are thick in constituency, it is another important factor. Many people use AC throughout the night. Some sleep in just direct below the fan at night. That all triggers this myofacial pain syndromes. And I have got a wonderful observation is living near the water bodies. Somebody is living very near to water body or very near to the paddy field. I have noted that very near to paddy field wherein the water is getting logged, where you are having a presence of Anubadesha like feature very near to your home. There is an increased tendency of developing this myofacial pain syndrome. This is a very anecdotal observation. I have not conducted any studies at all, but I have seen in many patients such type of observation. Now I am going to tell you about the background. Earlier I told you that many of the senior medical officers here, they will be having the experience that that I have shared, that if you go to manage the symptom, you will be at risk. Instead, if you manage the patient Samprapti, you can win. So I am going to have a just this detail about the Samprapti, wherein you can see chronic use of all these Nidana will vitiate the doshic balance. Sure, you are all sure. Will vitiate Rasa, Rakta, Mamsa, Medo, Dhatu. Very well sure. All these having, when the patient comes with myofacial pain syndromes, majority of them will be having loss of appetite. Majority of them will be having irregular appetite pattern. Majority of them will be telling us that they are having some pimples on the face, they are having some small papules throughout the body. Then majority of them will be having the pain in the diffuse muscle pain. They will be telling that their triglyceride levels are very high. So all those dhadus are affected. Sometimes there will be vitiated acne, many a time, vitiated acne and abanavada dushti. There will be amam, ajirnam, and consequence rodorotham. All these are very well visible. If you look with our tools means Nidana Panchagam and other tools which we use to identify the disease, you can see all these things are present there. And what happens here is, generally there is a background vitiation of Pitta which may be cryptic. In many patients I found that even if Pitta is there, Pitta is not present in the prominent form. If you ask the patient whether you are having any Pitta related symptoms, they will be telling many a time no, but there is some amount of raised Ushnatvam in their body. If you want to perceive Ushnatvam in the body, it is very difficult to perceive it in a male's body. But you just assess the female's body. When a female patient is coming to you, and especially she is in the reproductive age group, you are hitting many clues regarding the increased Ushnatvam. One important clue is regarding her menstrual cycle, wherein if she is having increased menstrual flow, that is increased bleeding, that's one important sign. Another one is the presence of profuse pervaginal white discharge. The third one, you can ask the lady herself that whether she feels increased perspiration, increased sweating, whether she feels burning micturition, whether she feels that she is always drenched in bad smelling sweat. All these are pointing towards increased pitta vritti, sama pittam especially. It's not the a good pittam, it is a sama pittam which is getting accumulated in her body because of this type of nidana. So the background, there is a pitta drishti. And you can see, and from the previous example of curd with Ushna Guna Dravya, likewise, if the pitta, if such pitta is interacting with the kapha, what will happen? Kapha should be sthira in our body. One of the important principles we should learn is, we are learning right from the first year that kapha is sthira. And majorly we can see kapha is seen in the upper aspect of the body, especially in serous. And so serous, urus, etc. are the main sthanas of kapha. So kapha should be sthira, and it should be thrida. It should be sthira in that particular area of the body, and it should not travel in the body. See, when Charaga is explaining the diabetes, the Prameha Roga Nidanam, he is very well saying that Bahu Drava Sleshma Dosha Visheshaha. The main primary accused or the primary component in the Samprapti is Bahudrava Kapam in Prameham. If somebody starts having Prameham, at the time of starting of Prameham, you can see that the Bahudrava Sleshma Dosha is present. Bahudrava Sleshma. See, Bahu and Drava. Drava means it is capable of spreading. Kapha undergoes vitiation when it gets the capability to spread in the body. Kapha should be sthira, it should be arrested somewhere, but when it starts spreading, it will create a lot of pathologies. So this causes, so when the pitta comes in contact with the kapha, what happens is that kapha acquires the capability of pitta. Pitta, we know that it is saram and drava. Here, the kapha is also starting to accumulate the same principle of sara and drava. So it starts syandanam. Syandana means abhishandanam. Abhishandana means dravi bhavam. Kapam starts becoming more drava at Shiras and Urtha Pravesha, and it migrates to other parts of the body with the help of Vada. Even it is not having the help of Vada, it can spread. But Vada is having a property of picking up such Drava Bhava Kapha to other areas of the body. That I am depicting in this particular model. So you can see one end there is Pitta, the other end there is Vada. In between there you can see the Kapha. So one end you can see there is Sama Ushna Drava Vrutta Pitta. Very, very important. Ushna Drava Vrutta Pitta. You are taking Kadurasa Ahara, you are taking curd, you are taking pickle, you are having noon sleep, you are having late night food, you are living in a concrete house, you are living near a water body. And all those factors which will trigger the Ushna Drava Bhava in Pitta. And this Pitta comes in contact with the Kapha, it causes the Syandanam of Kapha, and that results in loss of Sthira Guna of Kapha, resulting in increased Drava Bhava. And when the increased Drava Bhava is brought to Kapha, what will happen? The Kapha will start to migrate. That is reported as Prasaranam. And what happens is that sometimes the Vada will promote the migration of Kapha to other places. And when it promotes the migration, it will create Shoshana of Kapha. It will create Shoshana of Kapha. See, Vada is Ruksha. When it mingles with this Kapha, it will create a Shoshana of the Kapha. So Kapha now became Shoshida Kapha. It lost its good qualities. It lost its goodness of Snigdham, or its goodness that give its Shida Guna. Instead, it became more Ruksha, Khara, it became Shoshida. So you are having Shoshida Kapha deposits in many parts of your body. So this is a model, it's a pathological model. See, I am trying to introduce a very important point here. That is, if you open Ashtanga Hridaya Nidana Sthanam, the first chapter is Sarvaroga Nidana. Rest of the 15 chapters, all those 15 chapters are indeed 15 models of disease evolution. They are not diseases at all. If one says that Ashtanga Hridayam Nidana Sthanam is having 15 different chapters, which is pertaining to 15 different diseases, actually it is not correct. It is actually 15 different chapters, which is telling about 15 different pathways of disease evolution. So this model of disease evolution is available in Jwaram. In Ashtanga Hridayam Nidana Sthanam, if you go and check the Shidadi Jwaram, there Acharya says that Shidado Tatra Pittena Kaphe Sendida Soshide. The Kapha is undergoing Sendana when it comes in contact with Pitta. The Kapha is undergoing Shoshana when it comes in contact with the Vada. So this type of model is available in Ashtanga Hridaya Nidana Sthanam, second chapter, Jwara Nidanam, in the context of Shidadi Jwara. So this type of disease origin is what is being seen in the case of myofacial pain syndromes. So here you can see the seminar's terminology was the disease I have told is Irakkam. Neer means Irakkam or Neer Vircha in Malayalam. Neer means Jalam or Kapham, etc. Irakkam means migration or its spread, Prasarana, Vircha, etc. All says about Prasarana. So this is the Prasaranam of unstabilized Kapha to other areas of the body, and in the other areas of the body, Vada is creating Shoshana to particular Kapha, thereby creating Srodhorodha. So what happens later? It's another question. See, Kapha started moving. Sendida Kapha will be carried to distant sites by Vada. The Vada is creating Shoshana of Sendida Kapha. It gets localized in various sites. See, patient says that now I am having pain for 5 years, and in my elbow there is a small swelling I can see. Today also in my OP I see a patient who is saying that recurrently she is getting some swelling in the elbow area after the pain starts in the neck region. It slowly migrates down, settles down in the elbow, and elbow is becoming harsh. So such type of presentations they are telling, and you can see visible swellings somewhere in the foot, in the ankle region. Some says it happens, comes down and settles down at the forefoot. So in many areas you can see the deposition of Shoshida Kapha. and it creates impedance to movement of Vata, and that creates pain. See, Sulam to Viguno Anilaha. Sulam to Vigno Anila. Sula or pain is the primary manifestation of Vada, which is blocked. So blocked Vada presents as pain. So when the Soshita Kapha is deposited in some area, and when Vada tries to move through that particular area, it starts creating blockade of Vada, and hence there will be pain. So pain starts from these localized sites. See, then there will be a question: what is the myofacial pain syndrome? Is there any contemporary clinical equivalent? Yes. Myofacial pain syndrome is there. And in myofacial pain syndrome, when you read myofacial pain syndrome, now they are finding that there is a trigger point localized in the muscle. It is known as myofacial trigger point. It is a small, hard, tender region of the muscle. See, a myofacial trigger point is there for myofacial pain syndrome. The myofacial trigger point is actually the site of localization of Soshita Kapha due to action of Vata. It creates referral pain to different distant sites of the body. See, myofacial trigger point is not a passive area. It is a very active area of pain generation. So it generates pain. It refers the pain to distant sites of the body and different areas of central nervous system. And it creates the sensitization of central nervous system. So when the central nervous system is sensitized, what happens is that the threshold of pain of the patient is lowered, and in effect, the number of trigger points is expanded. So once when a trigger point is formed in the body at one particular point, it is having the capacity to project the pain to different areas. Also, it is having the capacity to initiate the formation of new trigger points. So this is very important. The patient coming says, I am having pain radiating down, and now in the heel region, I am having severe pain. When somebody touches that area, there is severe pain, severe tenderness. And patient says all these things came down from the head. So you will be naturally, there will be, in the initial period of my practice, when I hear this, I am bewildered how this happens. Some pain is coming down from the head and now localized in the foot. How this happens? So it is happening through this mechanism. So myofacial trigger points are formed under the influence of Soshita Kapha. So I have told about Samapittam. How can you identify Samapittam in a body? It can be verified by Nidana. Samapittam, when we look into the sloga, Ashtanga Hridayagara says that Durgandham Haridam Syavam Pittam Amlam Khanan Guru Amliga Kandahruttahakaram Samam Vinadvishet. See, the presence of GER, gastroesophageal reflux disease, very prominently seen in females. Also, pervaginal white discharge. Once I talked to a gynecologist, and I noted that many a patient coming to you with the female patient coming to you with the pervaginal white discharge, almost 80% of them are having this heartburn, gastroesophageal reflux, or some abdominal burning sensation. And when I asked a gynecologist about this, she says that in their opinion, the abdominal pain or the abdominal burning sensation is created by Helicobacter pylori, whereas this white discharge is created many a time by a fungus which is residing inside the reproductive tract. There is no connection. But for us, there is a connection. The connection is Samapittam. Durgandham, Haridam, Syavam, Pittam, Amlam, Khanam, Guru. Amliga Kandahruddahagaram. Kandahruddahagaram. See, we have got a connection. So we have got medicines to operate for that. That's a charming thing to know, isn't it? We have got medicines to operate for that. If you go and visit a gynecologist, she will give you medicine for H. pylori in one way, and the other way she will be trying to operate on the fungus. So this is the difference. So in males, there will be rapid hair loss. And if you also in Samavittam, if you ask the patient, they will be having severe burning sensation in the stomach if they are very hungry. And once they start to eat, the appetite disappears totally. Many patients tell so. If I am not getting food at the right time, there will be severe. In Malayalam, it is known as kalicha, fire kaluga, severe burning sensation. But a bit of food you take, your appetite is lost. So that's another sign of Samavita. I have told you about the Sendida Samakapha. Sendida Samakapha is seen when the patient says diffuse migratory pains. Patient says the pain is going through your body. A feeling of heaviness of head eyelids, the spreading heaviness in the body, rhinitis. Some patients say in the early morning time they started sneezing, continuous sneezing till the sun is at the top. So in the early phase, in the early morning time, the rhinitis is happening. All those shows the presence of Sendida Samakapha. And Soshida Samakapha, you can see, you just palpate the trapezoidal area if the patient is having tender point. The trapezoidal area is a vital area where there is more chance of finding out myofacial trigger points. Localized swellings which are happening in the elbow, wrist, ankle, etc., and heaviness of chest, abdomen. Many a time patient says, if their arms, if their thighs, foot, etc., are free of disease, the patient start to say that there is severe heaviness of chest. We will be feared, whether any attack is going to be precipitated. They will be telling about some abdominal pain, abdominal heaviness, etc. Also shows the presence of some Shoshida Samakapha. And in final, if you consider all those things together, you can see the Samprapti of Shobha is working. Pitta Rakta Kaphan Vayu, Dushto Dushtan Vehisira, Nitwa Rutha Gadistaihi, Kuryus Tom Mamsa Samsridam, Utseham Samhadam Shobham. The Shobha Samprapti is working here. Shobha is there. But you can see Asya Abhagarsha Gadi is the mechanism here. Asya Abhagarsha Gadi means when one dosha is in the balanced phase, if the other dosha increases, the third dosha Vada will take the dosha which is in the stable state to other areas of the body. Here you can see the Kapha was silent. Kapha was doing nothing. Instead, Pitta has created instability to Kapha, and hence the Kapha moved throughout the body, and under the influence of Vada, it got Shoshida. And this type of kapha prasarana can spread through the roga marga. See, it starts at grahani because of the patient's varied lifestyle pattern, varied dietary habits. The first area to affect is the grahani. The first and foremost area of affection is none other than grahani, and it finishes at the soft tissues. That's another important area. See, the soft tissue is none other than the Ubadhadus. So it crosses the shakha, it reaches Snayu, Kandara, etc., and settles down there in the Madhyama Roga Marga. So starts from the Abhyantara Roga Marga, passes through Bahya Roga Marga, and encroaches into the Madhyama Roga Marga. So this type of evolution, this type of sequential evolution of the disease process can be explicitly seen in the case of myofacial pain syndrome. So if you get a patient with myofacial pain syndrome, if you sit with that particular patient, ask the patient about all the sequences of development of disease, you can see that for great many persons, a majority of patients will tell you that they are having vitiation of Agni in the foremost time, vitiation of Grahani in the foremost time. Sometimes they will be presenting with the Grahani Roga like symptoms. Thereafter, they started having pain many a time in the different areas of the body, and finally, there is starting of myofacial pains. So such type of evolutions can be seen here. So what are the solutions? The primary solution, I will say, it is Nidana Parivardhanam itself. Battling with the medicines is having second stage only. If the patient is ready to take the food early, it will support him. If the patient is ready to put the AC off in the night, it will be supporting her. The patient is ready to avoid pickles from her diet, the curd from her diet, puppets, etc., and fried substances from the diet, that will be supporting. So, if the patient is ready to avoid all those substances which is increasing Ushna Drava Bhava in the body, that will be supporting. So Nidana Parivarjanam is having the cardinal role here, and the second stage is Samprapti Vigadanam. And for Samprapti Vigadanam, the primary point to ensure that if there is Samavittam, tackle the Samavitta first, then only you will be getting results. If you go and tackle the Vada and Kapha, what will happen? The Pitta will continue its action. It will destabilize the Kapha again and again, and it will come down through the Shakha to Madhyama Roga Marga. So the first and foremost area to be addressed is the Samavitta Nirharanam and its Pajanam. See, if you want to create Pajanam of Samavittam, if you use Kadurasa Dravya, because of Ushna Guna, the Pitta will vitiate again. So the option is Tikta Pajanam only. Tikta Rasa Pajanam only. And you can see in the third line that there is Pajanam, Jwarabaham, Pittaharam. The combination like a Shadangam is very, very important to be used here. Virejanam is a must in every week with Pittahara Dravya like a Krivat Avipatti Churnam, etc. And if the patient is having Krura Koshtam, and if you want to use a Pittahara Anilomanam, I have not written that Sugumar Erandam is another important choice. Sugumar Erandam with milk is another important choice. Then we can see we have to use medicines which are Pitta Kapaharam. Why? Because the Pitta is interacting with the Kapha, destabilizing it. So you have to we have to operate on both the doshas together. So the drugs like Guluchyadi, Padola Gadarohinyadi, Aragvadadi, etc. is coming to the forefront. And many patients will be presenting with the diffuse swellings throughout the body. So Sobhaharatvam should be another important component in the treatment package. So you have to, you might be, and you have to select such combinations which are Sobhaharam, Anilomanam, Pajanam, and Rakta Dushtiharam. See, such a good combination is Rasna Saptagam. Rasna Saptagam is a very important combination, which I need to tell here because all medical officers are employing it very well. So it is, at a time it is Sobhaharam. At a time it is Rakta Shuddhiharam. At a time it is Anilomanam, it is Pajanam. It's a wonderful combination. See, it's the main body which is used in it is the Prakshepagam which is used in it is the Ardraga Churna. So it is wonderfully Sobhaharam. Then you can see there is Pajanam Rakta Dushtiharam combination, none other than Manjishtadi. Manjishta, Trifala, Tikta, Vajadaru, Nishamrida. All those combinations. See, only two drugs are Ushna and Tishna, Vaja and Daru. All the rest are Shida, Pradhana, Tikta, Pajana, Aushadis. Tikta, Pajana, Aushadis. So it is a special type of wrapping you can see. The Tikta, Pajana, Aushadis are wrapped around two drugs which are Kadupajana. That is Manjishtadi, Rakta Dushtiharam, Rakta Shuddhiharam, Vada Raktaharam. And you can see there is Pajanam, Rakta Dushtiharam, Jwaraharam, there is Amrudotaram. It is Anilomanam also. Good Anilomana Dravya. Then there is Tikta Pajanam, Shobhaharam. The important combinations like Punarnavadi, Arthavilyam, etc. And when you need Pajanam, Jwaraharam, another important combination is Pajana Amridam Kashaya. So all those drugs which are not going to give you precise symptomatic results, but that is going to operate on the Samprapti, that is to be used in the first stage. And again, if the patient is telling you that by evening the dress is becoming very tight, in the morning time I can put on the blouse very easily, but after when I come back to the house, if I want to undress the blouse, it's very, very difficult. Many ladies are complaining this. And in such cases, Avil Toladi Bhasma as Bhasma Kanyi is a very important tool to be used. And if you have got associated rhinitis, sinusitis, etc., you cannot use very Tikshna Ushna Dravya. Instead, a moderate amount of Tishna Ushnatva can be provided by using Lakshmi Vidasarasam. Then definitely all these Samprapti has started from Grahani. So you cannot avoid Grahani in the treatment of this particular illness. So Agni Devanam and Grahani Stirigarana Aushati like Hingu Jadi, Vaishwanaram, Ashtajurnam, they are all having important place in the sequential management of this myofacial pain syndrome. And there are further, these are all initial stage medicines which you need to give for Pitta Samanam, Pitta Rejanam, Pajanam, Jwaraharam, Shobhaharam, Anilomanam, Raktadushtiharam. All those things I have mentioned. Now there are certain medicines which can be given for further Pajanam like a Shaddarna Churnam. And also the yoga called Chitragadi, Chitraga, Indrayava, Pada, Kadaga, Divisha, Abhaya. That's another important good combination can be used. And if there is increased Pitta Rekta Dushti, you can see, and there is a formation of some localized swelling in different parts of the body, we can, and if the patient is a Pitta Prakriti, one important choice I have not mentioned is Traindyadi Kashayam. Another important thing is that of Bela Guluchadi Kashayam, Bela Guluji and Devadaru. Bela is having the sinus of Avam, it is Vedana Stavanam. Then Guluji is Rekta Dushtiharam, Devadaru is Pandana. So that combination is very interestingly used here in the later stage of management of, not in the initial phase, in the later stage when initial Padanam has been wonderfully carried out. Now you can use the Bela Guluchadi Kashayam. Or and later on, when the patient's appetite is improved, when when the dhadus need actual nourishment, then you can go for the Kshira Kashayam. Then another important combination is Sahajaradi Kashayam. See the Sahajaram, Suranaru and Nagaram. Sahajaram, Suranaru and Nagaram is a wonderful combination. When added with the Satailam, it should be given Kshira Bela when there is total amavastha has been gone from the body. It is surely it is going to give you results. See the medicines of the later stage, they will address on the Samprapti when the kapha is getting shoshida by vata. The early phase medicines will be working upon the stage of Samprapti where the pitta is causing chendana of kapha. See the difference? When the initial phase we are focusing on the action of pitta on kapha causing chendana. In the later phase, we are focusing on the drugs which are curtailing the impact of vada, which creates shoshana of kapha. So in that way, Sahajaradi will try to pacify the vada, but at the same time, it will not allow the kapha to vitiate. Instead, it will support, it will nourish the shoshida kapha when Kshira Bela is added to it. So in such a way, the drugs needs to be crafted. And coming to procedures, the three important procedures which needs to be used in myofacial pain syndrome is Talam, Nasyam, Shiroabhyangam. And along with that, for localized swellings, you can use Lebanam. And after Pajanam in the localized area, we can give Dehabhyangam also. So coming to Talam, it's very common. Everybody is using it. Dasna, I am using also the same combination. Dasnadi, initially in Jambira Swarasam, later in Nimbamradadi Erandam. Likewise, if the patient is telling severe pitta dominance, burning sensation of scalp, eyes, ears, etc., burning sensation of nose, if the patient is having reddishness of eyes after bath, if the patient is telling she is sleepless, then Kachuradi, along with the Nimbamradadi Erandam or Kshira Bela Tailam is used. Then Nasyam with the Anudailam. I practice with Anudailam and Kshira Bela. In the previous Sunday, there was a webinar, an interview with a senior most clinician, Dr. VKV Balakrishnan of Pariyaram Ayurveda College. And he was telling that for chronic rhinitis, chronic sinusitis, he is using Nasyam by using Asavam, that is Pippalli Asavam, Vidanga Churnam, honey and Saindavam he is using for Nasyam. In the initial phase, he suggests this Pippalli Asavam, Vidanga Churnam, honey and Saindavam to be mixed, and he says you can start Nasyam from 3 ml onwards, and he even goes up to 7.5 ml each nostril. So such type of Nasya practices, they are doing wonderful. I am doing Nasyam not in the hospital. I will give for OP patients, I will advise them to do in the house, wherein by 11 a.m. they have to take a vaporizing good swedanam in the upper area of the body. Then lying down, they have to take this anadailam. I will tell them to start by using 2 ml, then 3 ml, etc. continuously pouring into each nostril. So that saves the situation. In some cases, anadailam cannot be used in the first phase because it's severely blocked nostrils can be seen. And also the patient will be having severe pain in the sinuses, severe heaviness of head. So depending on the amount of kapha, sendhita kapha in the upper area, you can use another patented combination called cephagale, which contains this Jambira swarasam. Cephagale, but it is very Tikshna Devya. So it should, dose should be at least maximally it should be 10 drops in each nostril. So thereafter you have to, after 3 or 4 days Nasya with that, you can shift it to Anadailam. And later on, if you want to give nourishment to those areas which are created Soshida by Vada, you can start Shirakala. Abhyangam is a very important problem nowadays. Every other person is listening to advertisements and try to pick up those oils which are promoting the hair growth, etc. So such oils which are over the counter used from markets, that will destroy the balance of pitta and kapha in shirahs, that will start creating myofacial pain syndrome. I have many patients telling that inadvertently they have used many oils which are available in market and that have created myofacial pain syndrome. And our former principal, Dr. Prasad sir, a famous practitioner here in Kerala, he has advised many patients to start at the time of starting treatment with a coconut oil which is boiled with the tulasi leaves. I have started practicing that which he tell to many patients, and I find that in the initial phase it stabilizes the pitta and the kapha. The common things like asana vidvadi, which is used in vada kapha, asana manjishtadi when there is pitta dushti, and trifaladi, which is used in severe vada vitiated situation when we fear there is a kapha vitiation on oil application. So you can use trifaladi. Trifaladi is tridosha hara itself. It contains milk. It is having the potential to pacify pitta also. So trifaladi is an ideal combination. If there is rhinitis, severe sinusitis, etc., Aranya Tulasiadi Keram is also very useful combination for Siroabhyanga. Anyway, if you do Siroabhyanga, ask the patient to have it before 10 a.m. or after 4 o'clock, before 6 p.m. See, either it should happen in the morning time prior to 10 a.m. or after noon 4 p.m. to 6 p.m. And ask the patient not to take the head bath when the scalp is wet. When the scalp is full of sweat, don't apply the oil. First, have the sweat gone from the scalp, then apply the oil. So if this properly cared, this Siroabhyanga will stabilize these 3 procedures. See, we have got Nasyam. The Nasyam is having a potential to stabilize. Nasyam is having a potential to throw out the Samakapam and Samapittam from the Urdhvanga. Talam is the Talam, we have seen that it contains one powder and Dravadravya. It is being mixed and applied on the scalp. It stabilizes the kapha on the scalp. Nasyam is having a Talam is having a very important property to regulate the Ushna in the scalp, and also it stabilizes the pitta in the scalp. And the third one is Siroabhyangam. It's a magnificent technology wherein you are stabilizing the kapha in the shirahs by using a snigdha dravya fortified with different other dravyas. Thailam, we know that if you put pepper into it, it will acquire the quality of pepper and it will become Ushnavirya. Thailam, if you process with the drugs of Himasagara Thaila, it will become very much Shida. So Thailam, if it is properly utilized, properly prepared with the different drugs, it can work on different doshas, create the balance of doshas in the shirahs. So in such a place like Indian subcontinent, where there is always excessive sunshine, where there is always excessive moisture, there should be Siroabhyanga. Siroabhyangam is a must, and selection of Siroabhyangam should be done as per the prakriti as well as the lifestyle pattern of the patient very carefully. Siroabhyangam is not done to protect the hair. Instead, it is done to prevent the migration of the kapham to other parts of the body. So it's a very carefully selected procedure. When we talk to Dr. Ramamutti Vaidya, who is the head of research in Vaidyaratnam, he says at least there are 44 different type of thaila which can be used for Siroabhyanga daily. So such a variety of thaila has been devised by the ancient clinicians, which can be used for safeguarding the prasarana of kapha throughout the body. And as the age advances, when the patient is coming to you with the more and more advanced age, look for Asti Dhatu Kshaya. See, it's very important. If the patient is telling that all her teeth is gone by 50th year, it's very important to check the vitamin D level. So Asti, you can predict the quality of Asti by looking into the dandam. So, Asti, you have to check the vitamin D. Nowadays, many people are having reduced vitamin D. Why? Because we are having less exposure to sunshine. And also, in patients with myofacial pain syndromes, it's very important to check the thyroid function. T3, T4, TSS, and at least very importantly, TSH needs to be monitored. And another important factor now I am seeing is the elevation of uric acid. Many people are coming presenting with the diffuse body pain like symptoms when the uric acid has gone above 6. Even though 7 is the cutoff value, many patients are having symptoms even after they cross the 5. So all these are very important. And if there is reduced vitamin D, if there is an associated hypothyroidism, if there is a hyperuricemia, this will aggravate the pain in different possible ways. So it creates different type of pain features. So I am reminding you of the use of Gandha in vitamin D problem. Ardraga Gridam. Ardraga Gridam is a wonderful formulation which is seen in Shobha Prakarana, wherein the Drabadravya is Swarasa of Ardraga, the Kalka is Ardraga itself, and then you have got milk also added to that. And this Krida is wonderfully prepared, and it is used in the case of Shobha associated with the hypothyroidism. Wonderfully working. If the patient is having less appetite, she presents with the pedal edema, dyspnea on exertion, says that there is evening puffiness, says that there is total loss of appetite, then you can give Ardra Gridam. It increases the acne, reduces the Shobha, etc. Then there is a preparation called like Shira Guluji, like that of Shira Bella, that is very well used in the later phases of treatment of uric acid. And in females especially, special care should be given regarding the presence of Samapita. I have told previously that there is chances of increased presence of Samapita in females that can be easily identified. And if there is pelvic inflammatory disease, use of Musali Gadiradi Gashayam, Shadavari Chinnaruhadi Gashayam, etc. to reduce the pitta, reduce the kleda in the body, and also the lehya preparations like Shadavari Gulam is very, very important to be used here. So in females, the drugs like Shadavari Gulam to regulate the pitta is very, very important to be used. And other advices is equally very important. Other advices, the first one is the food advice. See, regarding the food advice, ask the patient to stop the pickles, curd, fried food items, Chinese food items, etc. All the masalas should be put into the food after careful thought. It should be reduced maximally. Then ask the patient to eat only 3 times a day and to reduce the rice intake in the noon time. It's also very important. So the patient is asked to take only 3 meals a day, and the last meal of the day should be finished by 8 o'clock. And after that, the patient is advised to have a walk for 15 minutes in the front of the house. Then the patient should rest and sleep only 2 hours after the food is taken. So if the patient is taking food by 8 o'clock, she should sleep only after 10 o'clock. So that should be made mandatory. Then there are a lot of lifestyle correction to be given. Ask the patient to wake up early, have some morning walk every day. If the patient is very sedentary, you have to change the habit of that particular patient. You have to make the patient walk. You have to ask the patient to sleep at the proper time. You have to ask the patient to drink enough amount of water every day. So another important advice. Then oil application advice is also very important. Many people will be using different types of oils in the scalp that should not be promoted. As a physician, we need to identify a suitable oil and ask the patient to use it. Regarding the lifestyle advice, one important factor is regarding scalp bath that I have told earlier. Prior to 10 a.m. or after between 4 p.m. and 6 p.m. is the ideal time for bed bath. Then sleep advice we have given. Then mental stress is another important factor. See, when there is coexisting gastroesophageal reflux disease, what happens is patient says that I am having heartburn, I am having a lot of pain all over the body. The patient is so much stressed up. And when the stress goes higher, the esophageal sphincter becomes more and more lax. What happens? There will be more reflux. And when there is more reflux, when there is more heartburn. When the heartburn increases, mental stress increases. So this works as a vicious cycle. So ask the patient to get maximally relieved of the stress. So this much is the advices which we need to give the patient. And also when sleeping, it's not advisable to lie in a closed room with the air conditioner. Air conditioner is creating a lot many problems. So ask the patient, if very particular about air condition, she can put the air condition, set the timing for 1.5 hours, then ask it to stop automatically. And it's not advisable to lay just below the fan. It's just important to just move away from the direct heat of the fan. So another important advice regarding this much. So all those factors should come together, and if all these advices are properly being followed, and then the medicine is taken, the medicine will work, and the medicine will work on the Samprapti. And if the Samprapti is being broken down, Samprapti is not working properly, all the symptoms will come down. So instead of chasing the symptom, we chased upon the Samprapti, and the Samprapti got corrected. When the Samprapti is corrected, the symptoms will start coming down. So this should be the way of approach. What I feel with my limited amount of practice, I know that the case volume I am seeing, and you, the medical officers working in the ISN department, you are seeing a large volume of cases, and you can add to this presentation. I myself has given a bit suggestions from my part, and I tried to place it on the background of a theory, and any further advices, the portions which I have missed, the portions which you are not clear at all, or portions which you are suspicious whether this will work or not, you can add to this presentation. And I pay my very humble tribute to late Prakash Mangalesheri sir, who is my teacher, and he has shown all the doshas in the wards, how the doshas vary, how they interact with the dhadus, how they are creating srodhorodham. All these things have been regularly shown to us in the wards. He was taking a lot of painstaking hard work for teaching us. So still also, when I sit in the OP and prescribe to the patients, I still remember his advice coming in my ears. So I am placing this presentation as a humble tribute to him. And I thank you, all of you, for a very patient hearing. And I request all of you to add or to improve this presentation with all your good suggestions. Thank you one and all. And once again, I thank the organizers, AMI Attingal area, as well as Government Ayurveda Dispensary VARKALA, and its active campaigner, Dr. Aswati, for giving me such a good opportunity to meet you all and to have very humble presentation placed before you. Thank you very much.
Thank you, sir. So with that, we will move ahead. Questions ആർക്കെങ്കിലും ചോദിക്കാനുണ്ടെങ്കിൽ kindly mention in the chat box.
Yes, I think there is chat coming. Yes, I will read the questions which are there in the how to add tulasi to the coconut oil. One question is there. Prasad sir is telling that you have to boil the tulasi, boil the coconut oil lightly with some 4 or 5 tulsi leaves in it. That's sufficient, he says. And I have experimented with that, and I'm getting good results to people in the initial period with myofacial pain syndrome. And then Dr. Rohit is asking for my contact information. That's with Dr. Ashwati. She will be giving you. How that I think that's all with the questions which is here. Yes, that's all. No other questions I have seen. Anybody, if you have got any doubt or any additions or deletions or suggestions, please.
Sir, ഒരു question വന്നിട്ടുണ്ട്.
Yes, please.
Pus formation in sinus management.
I can't hear you. Please.
Pus formation in sinus management.
Sinus management. The first term, what you are telling?
Pus formation.
Pus formation in sinus. I think you are asking about sinusitis. This management of sinusitis is yet another important topic, but it is having the different aspects which I have suggested in this presentation. While managing sinusitis, it is important to control all these Nidana factors I have mentioned. Then you have to give Jwarahara Pajana Aushadha in the Kaphasthana. So I used to give Amrudottara Kashayam, Kanjanara Gugulu Guliga, Varanadi Kashayam, Kanjanara Gugulu. Then some Shobhara medicines like Arthavilyam Kashayam, Vinarnavadi Kashayam, etc. all are very useful here. And also this medicines like Lakshmi Vilasa Rasam, that is Surya Prabha Guliga, all these are working good in relieving the sinusitis. Taking vapors added with the taking vapors from boiling water, which is boiled with the tulasi leaves as well as Haridra Churnam, is also seen to be effective. And when you reach a certain stage, when the sinuses are all dried up, it's very important to shift to some type of Grida, like Gugulurita Grida or Varanadik Shira Grida or Indugandam, that will help to stabilize the situation. So this much only short about such a topic.
Okay, sir. Another question is, sir, which oil is best for migraine?
That's a very very tricky question because migraine is happening due to different reasons. So if we cannot tell, is there any best oil for migraine? I think there is no best oil for migraine. You select the oil as per the doshic situation. If there is severe pitta vritti, it's advisable to go for the oils like Bela Guluchari. But if asana manjishtavi, this is another option. Then the oil will not be sufficient. You have to start treatment. And if there is pitta vritti, another important oil is Bela Hadadi. Bela Hadadi coconut oil is showing good results in migraine along with medicines if there is associated very severe pitta vritti. So you judge the clinical condition. You should manage the different aspects like the food, lifestyle factors, stress factor, etc. Then ask the patient to use the different types of oils. So I cannot suggest a single oil, but all these oils are important in different contexts.
Okay, sir. One more question from Rohit. Any specific treatment for overweight?
Overweight. Overweight, yeah, I think it is Tavli Chikitsa itself. Nowadays, a lot of people are following those keto diet, etc. First of all, ask the patient to stop that, because punishing the body is not the answer for reducing overweight. Instead, you have to start walking. Many people come to us and ask, is there any medicine for overweight? Actually, reducing overweight by eating so much food, sedentary lifestyle, and taking medicine is impossible. So it's better to make the patient more and more exercise loving. Then ask the patient to take our supportive medicines like Varnadi Kashayam, Kanjanara Gugulu Guliga, Ayaskriti. Ayaskriti is an addition, and Navayasa Churnam. All those things are supportive for reducing weight. One important thing is to reduce the rice intake. Ask the patient to limit the rice intake for just 1 or 1.5 big spoons, big tawas, and leave the dinner with the 2 dosas, 2 chapatis, etc. Ask the patient to take more curries, vegetable curries, like leafy vegetables, like green gram, etc. Avoid those vegetables like potato, tapioca, etc. And those people who are fond of meat eating, ask them to limit it. Beef eating, reduce the intake of beef. So all those things in total will help you to reduce the weight. An important thing to remember is whenever you treat a patient with who wants to reduce the weight, it's very important to give a motivation to that particular patient. We should make it his target, and you have to constantly motivate the patient to reduce it. That's one important style of getting the patient's weight reduced. I think my answer is satisfactory.
Okay, sir. Next question. How can we find out sinus is dried up? Lakshanas, please.
The sinus is dried up because at the initial phase, the patient will be telling that when sneezing, a lot of fluid is coming up, the nostrils are blocked, and then severe heaviness of the sinus area. The sinus area will be severely tender. All those shows that that particular area there is significant amount of kapha presence. But when you start nasya, the patient says the tenderness is getting relieved. She says the nostrils are more and more opened up. But still, many people will say you that they feel dryness inside the nasal cavity. And also, after some more time, they will feel some pain inside the nasal cavity. So analyzing all these things together, you can predict that there is increased vata predominance in the nostrils. Next question.
Okay, okay, sir. Next question. Any role of Agnikarma in myofasciitis?
Agnikarma, I think Agnikarma is specifically useful when there is localization of pain. Some patients will be telling you with myofasciitis, but they are having the pain features like tennis elbow, golfer's elbow, bicipital tendonitis, then supra patellar bursitis. Likewise, a lot of localized swellings or localized tendon related endosopathies can be found out. I told you about the endosopathies like golfer's elbow, tennis elbow, etc. In such cases, if it is a clear case of Ubadadu Pradosha Vigaram, Sneham, Daham, and Ubanaham are the treatment. So Daha Karmam or Agni Karmam can be carried out. But for this type of diffuse pain, there is no possibility of doing Agni Karma. Only when it is very typically localized, you can do that. And sometimes the patient will be telling you the presentations like tenosynovitis. So we will be doing a test called this Finkelstein's test. Finkelstein's test, keeping the fingers like this and ask the patient to bend it. And then if there is severe tenderness at this particular point, so such pointed tenderness areas, you can have Agni Karma and it can give the result.
Okay, sir. Next question.
Dandruff.
Dandruff. Yes, sir.
Dandruff, as usual in clinical practice, there is Durdura Patradi Keram, and then ask the patient to use the shampoo. But before that, address what is the cause of dandruff. The dandruff is actually the production of a fungus which is settling in the scalp. So the scalp has become a favorite place of residence for fungus. So avoid the fungus by reducing the sweat, sebum, etc. So if the assess the patient, what dosha predominance is there. If there is pitta predominance, if there is more sweat to the patient, give tiktagam, mahatiktagam, etc. So then you can give Shariba Dhyasavan to the patient. So in such a way, you can reduce the body heat of the patient, can reduce the sweat of the patient, and then give external applications that will give you results. In the next question, Dr. Swati is asking, is myofascial pain syndrome occur without edema? Yeah, edema is not a correct term, I think. Instead of edema, I can tell you it's a swelling, diffuse swellings you can see. Actually, in the myofascial pain syndrome, the swelling is swelling, or the correct term is inflammation. The inflammation is happening where? It is happening in the fascia. Actually, now in anatomy, when you read the academic journals, we can see that the interest is putting more and more coming to the fascia, because when we were in the anatomy theater, we all remember that we will cut the skin, subcutaneous fascia, we will go in, and we are in a attempt to find out the blood vessels, nerves, muscles, bones, etc. We have never given a little mention to fascia, but now fascia is becoming more and more important. There is a good book called Anatomy Trains by Thomas Mayers, wherein he says, just like there is a network of blood vessels, just like there is a network of nerves, just like there is a network of fascia also. Fascia is the covering of muscles. So from one fascia to another fascia, the inflammation can spread. In such a way, the myofascial pain syndrome happens. So it's a traveling or migratory inflammation happening throughout the body. Then Dr. Malavika is asking whether asthma, what all medicines can be given. Asthma is a very big topic like this. Not single medicines you can suggest. There is a lot of problems behind that. Anyway, there is kapha in the urus, and it can happen by because the actual sthanam is amasya. So correct the amasya, Then give medicine specific to Swasarogam. So for correcting Amashyam, Hinguvajadi Churnam, Prafala Churnam for Anilomanam, etc. will be helpful. For correcting the Uravsthanam, Rasmula Gadatrayadi Kashayam, Vyakhyadi Kashayam, Elaganadi Kashayam, etc. are all important. So then also medicines like Swasanandam tablet, Lakshmi Vilasa Rasam Gulika, Kavagedi Rasam, all these will work wonders. So you just learn all these medicines, try to approach the patient with a Samprapti in your mind, then try to break that Samprapti by using medicines in your hand. So then we can learn how these medicines are working. So one weight loss treatment is being prescribed here. That's wonderful. Very strict diet is mentioned. Okay. Then one question from Dr. Sangamesh sir. In case of Ardhita Vada, whether it can be related to myofacial pain syndrome.
Yes, sir. Yes, sir. Yes, sir. Facial nerve and glossopharyngeal nerve deformity, sir.
Yeah. In Ardhita, I think that your question is in cases like a Bell's palsy, wherein there is lower motor neuron influence. Somebody says that they have traveled in bike without helmet in an early morning for 2 to 3 hours. And when they reach the destination, there is inflammation in the facial canal, and that had resulted in a Ardhita. Such cases, isn't it, sir? That is what you mean.
Okay, sir.
Isn't it? Such cases you meant, sir? Or I am not, that can be related to myofascial pain syndrome, but those...
No, sir. Related to that symptom only, sir. That deformity only, sir.
Yeah. That the other thing, that is the upper motor neuron lesions, they are all higher center lesions. That is not having any connection with myofascial syndrome. But this type of Ardhita Vada, element type, can be dealt by using the same principles like a Talam.
Yes, sir. Element only, sir.
Element can be dealt. It's a good connection, sir. I think the questions are finished.
Sir?
Yes. Any more questions? So I think I have shared some humble information from my practice. You just think upon all these things when you receive a patient like this, and just have more details and try to have more medicines which can be faithfully implemented in such situations. Thank you once again.
Thank you, sir.
Thank you.
Thank you, sir. നമുക്ക് conclude ചെയ്യാം, sir.
ഡോക്ടർ വളരെ നല്ല ക്ലാസ് ആയിരുന്നു കേട്ടോ. ഭയങ്കര ഇൻഫോർമേറ്റീവ് ആയിരുന്നു. എനിക്ക് തോന്നുന്നു ഞാൻ ഈ വെബിനാർ തുടങ്ങിയ കാലം തൊട്ട് ക്ലാസ്സിന് വേണ്ടി വിളിക്കുന്നുണ്ട്. പക്ഷെ ഓരോ തിരക്കായി മാറ്റി വെച്ച് വളരെ ഷോർട്ട് നോട്ടീസിൽ പറഞ്ഞു.
സജഷൻസ് ഒന്നും പറഞ്ഞില്ല കേട്ടോ.
അയ്യോ, എന്താ ഇതെല്ലാം നിങ്ങൾ കവർ ചെയ്തില്ലേ? നന്നായിട്ടുണ്ടായിരുന്നു എല്ലാം. എങ്ങനെയാ നമ്മളെ ശരിക്കും ഒത്തിരി കേസ് തന്നെയല്ലേ?
അതെ. അശ്വതി ചെയ്യുന്ന കാര്യങ്ങളും കൂടി ഒന്ന് പറയണമെന്ന് എനിക്കൊരു അഭിപ്രായമുണ്ട്. ഇത് ഞാൻ ഈ പറഞ്ഞ കൂടാതെ ഏതെങ്കിലും വേറെ എന്തെങ്കിലും ചെയ്യുന്നുണ്ടെങ്കിലേ.
അയ്യോ ഇല്ലപ്പാ, എല്ലാം കവർ ചെയ്തു. നന്നായിരുന്നു, നല്ല ക്ലാസ് ആയിരുന്നു. അപ്പൊ ഒത്തിരി ഇൻഫോർമേറ്റീവ് ആയിരുന്നു കേട്ടോ. നമുക്ക് ഒരുപാട് യൂസ്ഫുൾ ആയിരുന്നു. നന്നായിട്ട് എനിക്ക് തോന്നുന്നു എല്ലാവർക്കും ഈ ക്ലിനിക്സിൽ സ്റ്റുഡൻസിനായാലും ക്ലിനിഷ്യൻസിനായാലും എല്ലാവർക്കും എന്നുവെച്ചാൽ വേറൊരു അവരുടെ ഒരു ലെവൽ ഓഫ് തിങ്കിങ് ഒക്കെ മാറ്റാൻ പറ്റുന്ന രീതിയിലുള്ള ക്ലാസ് ആയിരുന്നു കേട്ടോ. എന്ന് വെച്ചാൽ യങ്സ്റ്റേഴ്സിനൊക്കെ അവർക്ക് ഒരു നല്ലൊരു ഗൈഡൻസ് ആയിരുന്നു. നല്ല ക്ലാസ് ആയിരുന്നു. അപ്പൊ നമുക്കെന്നാ കൺക്ലൂഡ് ചെയ്യാം അല്ലേ? കുറച്ച് സമയമായെന്ന് തോന്നുന്നു അല്ലേ? 9:45. ഭാഗ്യ.
Okay, madam. So as we come up to the end of the session, before winding up, let me thank our eminent chief guest, Dr. Rahul R. Nair, for accepting our invitation without refusal. Sir, the presentation was really great and informative. I take this opportunity to extend my sincere gratitude to Dr. Rahul R. Nair on behalf of GDH Varkala and AMAI Attingal Area Committee. And next I would like to extend my sincere gratitude to each and every participant for attending this webinar. Thank you for being with us till the end. And thank you very much, sir.
Thank you.